Hello everyone. My name is Asian Rochester and this is my final presentation of my educational approach for teaching physical examination as a future nurse educator. First, I'm going to explain the importance of why the physical examination is important in both nursing education and professional practice. The nursing process, which is one of the first concepts taught in nursing school, is a standard of care which consists of 5 phases to ensure nurses remain professional and effective. The phases of the nursing process are assessment, diagnosis, planning, implementation, and evaluation, also known as the acronym ADPI. Assessment is the very first phase of the nursing process and is the first step in the successful evaluation of a patient. Tony Butler and Unison Pace define nursing assessment as gathering information concerning the patient's individual, physiological, psychological, sociological, and spiritual needs. Critical thinking. Critical thinking is a multidimensional thinking process for sound clinical judgment and diagnostic reasoning by which we learn to assess and modify if indicated. It is recognized as an important component of nursing education at all levels. It is integral that assessments are conducted efficiently and that critical thinking is utilized to promptly recognize abnormalities, properly intervene, as well as prioritize care. Critical thinking is used to achieve the best patient outcomes in nursing by the nurse's assessment, interpretation, and action as means that contribute to achieving the best patient outcomes. The purpose of conducting a health history is to obtain subjective data, which is what the person says about himself or herself. Complete health history provides a complete picture of the person's past and present health. It also describes the individual as a whole and how the person interacts with the environment. The health history consists of the following components. First is biographic information. This is identifying information such as name, age, sex, primary language. Next is reason for seeking care. This is the patient's chief complaint in their own word, which consists of symptoms that they've been having. Next is present health. Present health is a short statement about the patient's general state of health and goes in depth for the ill person to identify location of symptom, onset, duration, character, quality, timing, aggravating and associated factors, and the patient's perception of how it affects their activities of daily living. Next is history of illnesses. This includes illnesses during their childhood, any accidents or injuries, chronic illnesses, hospitalizations, operations, obstetric history, immunizations, allergies, and their last physical exam. Next is medical reconciliation. This is any prescribed medications that they're currently taking and or any over-the-counter drugs, supplements. Medication reconciliation is important because it helps to reduce errors and promote patient safety. Next is family medical history. Certain diseases and conditions may be vulnerable due to family history and make the patient be at an increased risk. Certain diseases that run in the family are coronary artery disease, hypertension, stroke, cancers, diabetes, obesity, blood disorders, mental illnesses, drug addictions, suicide, seizure, and kidney disease, just to name a few. The next is review of systems. This is to evaluate past and present health state of each body system and to evaluate health promotion. Next is functional assessment. This measures persons' self-care ability to perform activities of daily living such as eating, bathing, ambulating, dressing, toileting before their illness and currently during their illness. And the last component of the complete health history is the patient's perception of health. It's a definition of health in their own words. Also, you would address their concerns, if they have any questions, and assess their health goals. So, next, the physical assessment requires you to develop technical skills and a knowledge base. The technical skills for physical assessment cultivate senses by utilizing smell, sight, hearing, and touch. 4 skills are performed one at a time and in order. Inspection is first, palpation, percussion, and auscultation. The only time that it's not done in this order, the only exception is during the abdominal assessment, where auscultation is done after inspection, because percussion and palpation can increase peristalsis, which can alter normal bowel sounds and give false interpretation. So, inspection. Inspection is concentrated watching. You're observing for symmetry on both sides of the body. Palpation uses senses of touch to assess temperature, moisture, swelling, pulsation, crepitus, lumps, masses, tenderness, or pain. Light palpation is done for surface, and deep palpation is after. Next is percussion. Percussion assesses underlying structures, uses sound to depict location, size, and density of underlying organs. And last is auscultation. It's listening to sounds produced by the body using the stethoscope for evaluation. Okay, so learning styles. So VARC learning styles. VARC stands for visual, oral, reading and writing, and kinesthetic, which focuses on a person's preference to receive and send information that is learned. Assessing learning styles as an educator is important in creating a versatile atmosphere to encourage and allow readers to reach their full potential and more efficiently meet their learning outcomes. Using a variety of teaching styles will assist in delivery of the educational content in a way that is most accepted by the majority of students. Teaching methods and techniques should be based on 3 domains of learning to be most beneficial to the learner, which is cognitive, psychomotor, and affective. So for visual, these learners learn by step-by-step instruction and graphics. Oral or auditory is listening to lectures, participating in group discussion, and establishing study groups. Reading and writing is reading course material, evidence-based references, and additional sources for information. And last is kinesthetic. This is hands-on activity where the learner learns through demonstrating, simulation, role playing. So for teaching methods, there is no one perfect method for teaching. People learn best when methods are in conjunction with another method to accompany the teaching approach. The first method I plan to implement as a nurse educator, of course, is lecture. Lecture is one of the oldest and most often used approaches in learning. Lecturing is a highly structured method by which the educator verbally transmits information directly to a group of learners for the purpose of instruction. So, the pros of lecturing, the first is that it presents unique ways of viewing information. You're as an instructor, you're able to highlight main ideas, describe patterns, and can include their own personal expertise with both theory and experience to help the learner understand the topic. The next pro is that lecturing provides foundational background. You're able to introduce new material, continue discussion on a topic, and sum up course content, as well as present large blocks of complex and confusing information, which can serve as a basis for subsequent learning, such as follow-up group discussion. So it's an ongoing practice, but lecturing provides the foundation for a topic. And the next pro is that it can be easily supplemented with printed handouts, websites, textbooks, and other audiovisual materials to enhance learning. So some cons to lecturing. The first con is that it's a passive learning role. It does not provide for much stimulation or participation from the learner. The next is that it's instructor centered. The most active participant in this method of learning is the instructor. They have expertise and they're the ones sharing knowledge. The last con is that it does not account for individual learning styles. All learners are exposed to the same information but are not given the opportunity to process it, at least not at the time during the lecturing. The second method I plan to utilize as a nurse educator is demonstration and return demonstration. Demonstration is done by the instructor to show the learner how to perform a certain skill. Return demonstration is carried out by the learner to establish competence with cues from the instructor as needed. So some pros of demonstration and return demonstration. The first is that it actively engages the learner through stimulation of visual, auditory, and tactile senses. The next pro is that it provides opportunity for overlearning to achieve the goal. Different learners will need different amounts of time to become competent, but once the skill is acquired, practice will increase speed and proficiency. The next pro is repetition and constant reinforcement increases competence, skill retention, and confidence. So, of course, there are cons of demonstration and return demonstration. The first con is that equipment can be expensive. The group size must be kept small to ensure each learner is able to visualize the procedures being performed and to have the opportunity to practice. And the last con is that individual supervision is required for follow-up practices, and time has to be set aside from teaching as well as learning. The third method of teaching I plan to utilize in the future is simulation. Simulation is a highly innovative teaching method to teach healthcare professionals about the complex world of healthcare in an effective, efficient, high-quality fashion. With simulation, the first pro is that it's a safe environment to learn and make mistakes. Students are able to practice assessment, patient care, communication, teamwork, decision making, and clinical skills in a non-threatening environment for learning. The next is critical thinking. It enhances critical thinking and problem solving. It fosters improved clinical judgment through higher level problem solving. And the last pro is it has better outcomes for students. Positive impact on nursing education and the quality of patient care. Not only do these activities let you demonstrate your skills, but do so in a contextual learning environment. And then there are some cons of simulation. The first is that it also can be expensive. It's not readily available to all learners and can be labor intensive. To aid the processing of information, which is learning, and then apply this knowledge in context, which is situational awareness, Peyton's four-step method technique can be utilized. The Peyton model provides a better means of teaching physical exam skills than the traditional see one, do one, teach one model. The Peyton model consists of 4 steps. The first step is demonstration. This is where the instructor performs the exam at normal speed without commentary. The next step is deconstruction. This is where the teacher repeats the procedure, but this time describing all necessary steps and sub-steps. The next step is comprehension. This is when the instructor performs the exam while the learner describes the steps. And the last step is the learner performs the exam while also describing the steps. So this teaching approach allows the learner to be exposed to the information multiple times and also has time, gives the learner time to demonstrate it as well as ask questions and provide feedback, which all aids in retention of information that's learned. So, evaluation methods. The nurse educator must ensure that nursing students have the knowledge, attitudes, and skills that demonstrate essential competencies for the delivery of safe, high-quality, evidence-based patient care. Evaluation is a process within other processes. So evaluation equals decision-making process, education process, and the nursing process. So content evaluation, the purpose is to determine whether learners have acquired the knowledge or skills taught during the learning experience. So this can be evaluated first through skill competency checklists. This is when instructors often evaluate students on procedures using competency checklists. This is basically like a skill sign-off where the learner and the instructor both have the same list of steps in order to complete the skill. And as the learner is demonstrating, the instructor is ensuring that they're hitting each step and completing them properly. Next is exam. Students take tests to assess their knowledge of medical terminology and basic nursing care procedures, and skill assessments as well. Um, Faculty use these scores to gauge the progress students are making in nursing programs. And next is learning outcomes. The most important part of each lesson is in the very beginning, during which the instructor informs the students about the concept to be explored, why the concept is important, and what the learning outcomes for the lesson are. Learning outcomes are goals that describe what a student will be able to do as a result of a learning experience. Instructors should take care to be sure instructions and outcomes are clearly stated and easy to follow. And then these are my references. Thank you so much for listening to my presentation, and good luck with the rest of all of your courses.